patient into Sidelye for short term. You have to pay attention to the person and the task and the environment first off. So with this individual, he has a normal spinal alignment. So his comfort would be by putting a pillow behind his head, and also if we can go ahead and show that we have a towel underneath the lower part of his waist to achieve a normal spinal curvature. We also flexed his knees up in some sort of degrees of flexion, or you could have done in some degrees of extension, just to make sure that the patient has their stability and is safe. You feeling okay?
Yes.
This is a video about proper patient positioning and Sidelye for short term. Things that we really want to make sure that we're taking caution with is the objectives. So we have to create patient safety, and the way that we do that is by creating borders so that the patient does not fall over the table. So we have a patient holding on to a pillow right here, which is definitely going to help with that. Another thing that we want to take into consideration is safety of the exposed area. So we just have one certain area that we'll be working on with the patient today exposed to us. Next thing that we want to take into consideration is the patient's comfort. And the way that we will do that is by allowing the patient to have proper positioning for the pillows. So we have one behind the head, one that the patient's actually holding. We put the hips in 30 degrees of hip flexion, and we put a pillow in between the legs, with hopes that all of this will neutralize the spinal alignment and allow the patient to be in the most comfortable positioning as possible. The next thing that we want to make sure that we have is therapist area of treatment. So we just want to make sure, like we mentioned, that this is the only area that's exposed for the patient for their comfort and for their safety. Demonstration is going to show a patient in short-term seated positioning. So we already took our measurements so that the patient is in full comfort regarding the chair fitting the patient properly. We want to check that his knees and his hips are in that 90-90 position, so that is inhibiting any sacral sitting. We have a towel rolled underneath the patient's waist so that we have a neutral lumbar and spinal alignment throughout. And we also want to make sure that we have some pillows here so that the shoulders aren't fallen and they have a nice degree of flexion within. Next, I'm going to demonstrate how to put a patient for short-term seated positioning. I have the chair facing the table with a couple of pillows under his head to neutralize his neck and his shoulders in a comfortable position. The wheelchair locks are on and he is fitted in it properly. I have the patient in this positioning so that I have full access to the treatment area. I have a towel for draping, so I'm giving the patient their comfort and security, and I will only be working on the specific area that's shown.